Hey guys, welcome back to another episode of Clinical Studies Made Simple. I'm your host, Austin, with Launch Medical, okay? Let's jump right in. We got a study from 2015, okay? This one's called the Evaluation of Clinical Efficacy, Safety, and Patient Satisfaction Rate After Shock Therapy, Low-Intensity Extracorporeal Shockwave Therapy for the Treatment of Male Erectile Dysfunction. An Australian first open-label single-arm prospective clinical trial. That is a mouthful, ladies and gentlemen. Basically, all they're doing in the study is they're evaluating shock therapy on men with erectile dysfunction. Let's jump right into it, okay? The objective: to evaluate the efficacy, safety, and patient satisfaction rate with shock therapy in Australian men, those Australians with ED, okay? As shockwave therapy induces, this is a big word, neovascularization. That just means growing new blood vessels, and potentially enhances penile perfusion. What does that mean? Penile perfusion, just the amount of blood flow, okay? The amount of blood flow, potentially enhancing the blood flow in the penis, and improves erectile function. Okay, let's jump straight into it. Treatment consists of 3,000 shockwaves twice a week for 6 weeks, okay? That's 6,000 shockwaves a week, all right? With the rocket, the actual performance protocol is 15,000 shockwaves a week, okay? So with the rocket protocol, you're actually getting more than double what they did in this study. So keep that in mind as we pay attention to the results, okay? No side effects with shockwave therapy were reported. Most patients reported an improvement in IIEF score by 5 points. Okay, that's the erectile function score. I covered that in another video. It's a great way to determine your sexual performance, your sex life, your erection health. It's an actual numerical score that they use in these studies to test improvement with shockwave therapy. So if you think about getting the rocket, if you want to do the rocket, go ahead, click on that video below. It'll take you to another video where I break down this IIEF questionnaire. You can figure out your own score for yourself, and then once you use the rocket, you can test yourself again and see how much improvement you've made. All right, most patients were satisfied and would recommend the therapy to their friends. Awesome. So the conclusion: shockwave therapy appears to improve erectile dysfunction, is safe, and potentially plays an important role in penile rehabilitation in men who failed medical therapy. Well, there you have it, guys. That's it. Plain and simple. There you have it. You can see the video. You can see the actual study below. You can read it with your own eyes. And that's it, guys. All right. Again, if you want to get your rocket today, go to getmyrocket.com. We got a little special deal going on for you right now. And if you want to test your own IIEF score, click another video below. You can test your own score right then and there. Once you get the rocket, you can go ahead and test your score again to see how much improvement you made. All right, guys. There you have it. That was it. Clinical Studies Made Simple. I'm your host, Austin, with Launch Medical. Talk to you guys later.